The following portion of Daytime is sponsored by Moffitt Cancer Center.
Sun protection is a key part of preventing skin cancer. And joining us now with expert safety tips and important info on skin cancer rates is Dr. Vernon Sondak with the Department of Cutaneous Oncology at Moffitt Cancer Center. Doctor, welcome. Nice to have you here.
Nice to be here. Thank you, Maggie.
Let's start with the basics. What are some sun safety tips?
Well, we just turned to spring and summer is right around the corner. We can already tell by the temperature. That means a lot of ultraviolet in the air. We have to protect ourselves. We love it being in Florida with all the sunshine and all the outdoor activities, but we have to be smart. First and foremost, I like to remind people to cover themselves when the sun is really intense, especially between 10 and 3 o'clock. A broad hat to cover your ears and your neck, not just a baseball cap. Long sleeves, long pants are better even than using sunscreen. But if you're out in the sun, any exposed areas, sunscreen at least a 30 SPF, sunglasses, protect your lips. All of those things are important to think about.
Because prevention is ideal, but if you have skin cancer, what are some signs and symptoms that you should look for?
So skin cancer could be any kind of a changing mole or lesion on the skin, a sore that doesn't heal, but we're particularly interested in melanoma, which is one of the deadliest forms of skin cancer. It's usually pigmented, meaning darker than the normal skin color, but not always. And so we look for the A, B, C's, and D's, a lesion that's asymmetric or has an irregular border or a very dark color, and especially one that's enlarging. The diameter is getting bigger and bigger. Those are the things we're looking for.
Is it a misconception, doctor, that African Americans don't get skin cancer?
It's a big misconception, absolutely. Anyone can get skin cancer. No one is immune. It just happens in different places. Many people are surprised to find out that Bob Marley died from melanoma. In him, it started on his toe, which is an unusual, but not that unusual place for melanoma to start.
And are steps being taken to improve skin cancer outcomes in the Black community?
Well, it's still a big difference, a big disparity in the outcomes for blacks with cancer compared to almost every other skin color. And it starts with recognizing that it can happen so that it's not picked up quite so late, but it also includes being able to get in for treatment, getting onto the latest treatments, clinical trials. All of those factors play into it. We're trying to address all of them.
So what treatment options are available at Moffitt, and how do you get an appointment?
Well, we cover the entire waterfront of treatment for all cutaneous malignancies. Fortunately, many skin cancers, if they're picked up early, can be treated just in your local doctor's office, just with local anesthesia. But if it's more advanced and it needs to be treated at a place like Moffitt, we do surgeries, we do immune treatments, and most recently, just in the last month, cellular therapy, tumor-infiltrating lymphocytes. We can now take a person's own tumor out when all the other treatment approaches have failed, grow the cells of their own immune system out of that tumor in the laboratory and reinfuse them back a few weeks later. Wow. It's called TIL therapy, just got FDA approval, and Moffitt is one of the leading centers for that.
Wonderful, and so easy to make an appointment because you don't even need a referral, right?
If you have a skin cancer and you need to be seen, just give us a call. Your dermatologist can get us directly, but you can also call directly to us.
Dr. Sondak, thank you.
Thank you.
And if you'd like more information, you can visit moffitt.org/outcomes. Daytime will be right back.
The preceding portion of Daytime was sponsored by Moffitt Cancer Center.